Hey guys, Gary here. I'm here with my good friend Mike.
Gary?
What I wanted to talk to you guys today about is a battlefield situation IV. And that goes a little bit beyond like the immediate treatment that we always talk about with blood loss and tourniquets and wound packing and et cetera, but for a little beyond that care, an IV. And Mike here is an IV expert. Would you say?
Yeah, I'd say so. I work in an ER, so I kind of have to be a little bit on that.
So he does a lot of IVs. So I'm actually going to get an IV today, and Mike's going to walk us through it. Before we get to the IV point, if somebody needed an IV out in a, and we're going to keep to the strict idea of a battlefield situation, so it's going to be sometime prior to, professional medical care showing up.
Absolutely.
So if we can beat them to the punch and get something done before they get there because of time constraints, we will. But what kind of things would we be looking at that aren't going to happen that would happen in a normal?
In a normal setting, in a hospital setting, the doctor is going to write some orders, and you're going to go and perform those orders. In the battlefield setting, most likely you're not going to have the doctor there, so you are going to be the one doing those orders. So most importantly, you're giving somebody hydration. You're trying to fill up their vascular space. Something happened to them, they're bleeding out, they're dehydrated, they need some fluid. So most importantly, you need to stop the bleeding that's going on. That could easily be done with a tourniquet, like Gary had said. I'm sure he has done other videos where showing how to apply tourniquets. But apply a tourniquet, then the next step is to get an IV and to give some fluid to try to get some hydration back into him. Without any blood in the vascular space, you're going to die. At least with some fluid, you can get that blood pumping throughout your body, getting the red blood cells that carry oxygen to oxygenate your heart and your brain.
So it isn't ideal as the proper hydraulic fluid, but anything in there will keep the hydraulics at least able to bring the blood where it needs to go.
Yes, and in a battlefield scene, your safe bet is using normal saline. Normal saline is what they use all the places. You're not messing up with like electrolyte imbalances, but you're using normal saline to kind of hydrate that, to get some extra volume within the vascular space.
Right. So, and for those of you who don't know this, saline is a controlled item. I don't know what the technical term is. You can't just go buy it somewhere.
Unless you're Gary.
Well, thanks to Tyler, I have some saline. But if you can locate it, by all means, it's something good to have. For the demo today, we're just going to use this small bag because since the big ones are so hard to come by, you guys really aren't worth me investing one just for a demo. So we will use the little one for today's demo. Sorry if you don't like that. You can send me some more, and maybe I'll do another video using a whole bag. How efficient is, say, just for dehydration purposes, how efficient is the IV compared to oral rehydration?
Well, the IV is much faster. It's going right into your vascular supply, so you're not going through a GI tract at all. And the biggest thing is, like, people get IVs though is because they're unable to take oral hydration. Okay. So if something happens, if you're unconscious, I can't give you a straw and say, hey Gary, drink this.
Right.
So it's going into the vascular space because you can be unconscious, you could be conscious, and it's going to go right to your vascular supply. So, and the whole big point is of the IV too is you want to get that blood pressure up. There's certain ranges of blood pressure. Obviously the 120/80 is the normal. But if you're bleeding out, your blood pressure is going to be much lower. We need to get that up a little bit. And it's going to take too long doing it by drinking. So the IV is instant.
Awesome. I can say from personal experience back in my Navy days that an IV is the ultimate hangover cure. Just throwing that out there, that it does work great for that, like instant, you're back from the hangover. I do not have a hangover today, so we will get to actually doing the IV unless there's something else we need to discuss beforehand.
We can talk about that going
All right, I'm just going to hold the camera and let you go to work, and you can narrate as we go. How's that sound?
All right, sounds good.
All right, let's get to it.
Gary, as a going away present for him before he left for a tactical response, I showed him how to start an IV. And I figured at some point in time in his life he may need to do that. And I figured what better gift to give a man than some knowledge. So he had acquired through some other sources some supplies, and I showed him how to actually use those supplies. So one of the big things I want to talk about a little bit today with starting an IV is, you're on a battlefield, but the idea is you still want to maintain some type of aseptic technique when using it. So aseptic, what does that mean? Kind of sterile, clean, and we're not exactly in an OR, we're not under sterile drapes or anything like that, but we need to kind of be as clean as we can. So what's something we can use? We can definitely use some baby wipes here. And why would you say that? Well, think about it. You're out shooting guns, you're running around and stuff. You know, some baby wipes are the first step you can use to kind of get some of this crap off your hands before you put gloves on. Just a way, you know, whatever we put in this IV is going to be going into his blood supply. So if we have a bunch of dirt and grime and bacteria on our hands going into his vein, well, there's no point to hydrate him in the first place. You might as well just let him die because you're going to kill him eventually. You know, that goes straight to your heart. You know, the whole idea is, you know, we don't want to kill Garry. We want to save Garry. So that's the whole point of this. So we'll clean it. The other thing we do, we have gloves, and I'm going to wait a minute here for my hands to dry to get rid of that tackiness, but we're going to put gloves on too. We have alcohol wipes here. We're going to gather some of our supplies. So what are we going to need to do this for Garry? Well, first thing, you know, Gary's going to demonstrate this little bag of normal saline here, so we're not wasting an entire liter bag of fluids. So what do we do to get that started? Well, first you need an extension set, or not an extension set, an administration set. So this is something that's going to have a drip chamber. You know, you can use this to control how fast fluids are going in. The whole point though, we're in a battlefield, so we want this to go in fast. A big bag like Garry has here, a liter bag of fluids, you can typically get a liter bag of fluids in about 15 to 20 minutes in a person, just hanging it off of gravity. Gravity means about probably 3 feet above a person's head, and you get a good vein that'll go in. So good vein meaning, you know, you don't want to do something in the wrist. So like right here in Garry's wrist, if he's bent it like that, you're going to cut off the flow. You know, the anacubical area, like right here, the AC, that's like a great place to do IVs, you know, if he keeps his arms straight. You know, the forearm is a good place too, because no matter what you're doing, you can keep a straight spot. The idea is you want to start a little bit lower in the hand, and if that becomes a bad IV site, you can always go up. So we start in the hand, keep on going up, 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 and you know, eventually you're gonna get to a point, you know, you get much more above here. You can do a couple up in the upper arm, but after that point, you're gonna want to look in the other arm. And if you have attempted that many IVs and kept on missing, you suck and need to do something else in life. What questions do you have, Garry?
Where are we gonna do this one today?
Well, this one today, going off of the supplies Garry has, that's another thing. So let's talk about IVs. So there's many different sizes. The smaller the number, the size of the needle is actually the larger needle.
Kind of like a shotgun.
Yeah, kind of. So if I have a 16 gauge, which is going to be a rather large IV, you really, you know, in traumas you would use these. But for everyday use, you would typically use an 18 gauge. And what else do you have here, Garry? And you have a 20 gauge. So a 20 gauge and an 18 gauge, you know, 20s work good in the hands. 18s would probably be a little bit better, more in the forearm or up in the anacubical area. So before we do anything, we want to prime our tubing then as well. So a lot of people always say, you know, you hear somebody, oh, an air bubble, that's bad, that's going to kill me. You know, a little air bubble in the tubing is not going to hurt you. However, if I would hang this bag and not prime this tubing, that could potentially kill you. You can get an air embolus, and that's going to be fatal. So first thing we're going to do, we did clean our hands, and all this is not touching, so we're still maintaining an aseptic technique. So we're going to go ahead and pull this off, and we're going to spike this bag. So now we're going to prime it. So we should stop the tubing first so we can get, you want to fill the chamber, and from here, we're going to hold this up, and we're going to get this fluid all the way through this bag, all this line, till we don't see any more air bubbles down here. So we're leaking, so we're good. So we're going to go ahead and close that off right now. So this is completely filled with fluid, so it's ready to use on Garry. There's no air in there right now. And they always have a little safety protector cap at the end, and that's to prevent it from getting dirty. Another thing, you don't want to take that off, let it start banging around the ground, and then we go and hook it up to Garry, and you know, then we just introduce something bad into his body. And this is to protect you and to protect him. So, you know, I don't know what Garry does in his free time. He doesn't know what I do. So it's best not to get his blood on me and my blood on him.
There might be midget transvestite donkeys.
There most definitely probably is. So we have a tourniquet. What we can use for a tourniquet is these little pieces of elasticy, or we can use a blood pressure cuff as a tourniquet. You know, if you don't have a tourniquet like this, a blood pressure cuff works great. Just put it up above, pump it up about 20 to 30 above what his blood pressure is, and you are good to get. The idea is to dilate the vein down here. So to dilate the vein backs up the blood, allows the vein to get bigger, makes it easier to put an IV in.
Would a CAT or a TK4 tourniquet work just
Absolutely.
fine? Awesome.
The key is you want to take it off. You never want to leave this on after the fact because you're going to stop all that fluid from going in. So we are going to do that. And so Garry has a nice vein right there in his forearm, and that's the one that we're going to use today. Why? Because we are going to give Garry a 16 gauge IV. Why? Because Garry is bleeding out right now. And this is an extension set that we're also going to use. So an extension set, as you can see the IV right here, we'll pull this out again. This is what's going to go into Garry here. All right, an IV is made up of a couple parts. You have the needle, which helps go in, and then you have this little white catheter. The white catheter is flexible in what's going to go in, and the needle is what helps guide it in. There's a little bevel right there, if you can see that. You always want to make sure that bevel is going down. So that bevel is going to go in against the skin. And then you can see this comes out. So when we put this in, we're going to have to hold some pressure there to stop any blood from dripping out. If we would just let this go, Garry's going to bleed out because we just made a hole into his vein and it's draining outside. So that's the purpose of an extension set. We can put an extension set, screw that onto here right there, and that closes us off with a little tube there. Not a tube, but a little
valve.
A little lure lock is what they call it. So the other thing we need to do then here too is use a flush, which is just normal saline, usually like 10 mLs, and we're going to hook this up here to our extension set, and we're going to prime that as well. So the whole idea is to not have any air in that as well. So that's also ready. We're going to use an alcohol wipe to prep Garry's arm because it's probably falling asleep right now with how long we had that tourniquet on.
I've had them on tighter and longer. Not that I'm questioning your manhood, but...
Alright, so you want to scrub about 30 seconds. This is an alcohol wipe, and the key is they tell you to never go back and repalpate. So you would never go back in and retouch that then because that'd be introducing bacteria. If you feel the need to do it, you know, you can always try to rub your finger again with the alcohol wipe, but they definitely advise you not to do that. So again, this is a 16 gauge IV. Every one of them is different. This one's a little bit shorter, so we will do our best to get this into Garry here. So we're going to pull down, hold traction, poke it in. And we have a blood return. So we're going to force this in a little bit easier, a little bit more. And we're going to slide this up into Garry right here.
He's been dying to do that. Slide up into me.
We're going to hold pressure right here because this is going to come out. And we want to throw that in a sharps container. Now is when you want to pull this cap off the extension set. You're going to put the extension set onto the IV, and we are going to go ahead and flush it. So you can see you have a little bit of a blood return. We're flushing it. So we can pull that off. Now we're going to release the tourniquet, all while maintaining his IV here. And yes, miss. So Garry's infected midget blood is all over now. Another reason why we're wearing gloves though. On the battlefield, you have no clue who the person is. Hopefully you do, but you might not have a clue of who the person is, and you might need to give an IV. So it's always good to protect you and protect the other person. All right, so now we need to secure this down. You always want to make sure there is some type of window. You don't want to put tape over top of the site where it actually goes into the skin. You want to be able to observe that. So we're going to put this on top right here, and we have that secured right now into Garry. All right. So from this point forward, it's always good to use another alcohol wipe to wash this off at the bottom, just in case that did touch anything. And we're going to go ahead and take our bag of fluids now, and we're going to connect this into Garry. We're going to take this, we're going to hang it up, and you can see the blood going out of his IV and the fluids going into his body now. So this will go in fairly quickly. You can see the fluids are draining kind of rapidly here. And this bag of, what is this, Gary? This is a 100 ml bag of fluids. This would probably go into him in about, like, I don't know, a minute or two with the size of the IV is there. Another thing we're going to want to do at this point in time is to go ahead and kind of secure this down a little bit further. And so we'll go ahead and clamp this off here. They usually send some extra little pieces of tape here, and we're definitely going to want to go ahead and put that down a little bit more. And you can also loop your tubing back a little bit more. And what this does, this prevents it. If something happens, they tug on him, it's going to prevent it from ripping his IV out that you worked hard to get. You know, he may be loaded into a vehicle now, getting into a helicopter, something happens, we don't want that to get ripped out and have to restart it.
Drug through the woods on a litter.
Absolutely. So, since Gary hooked it up, we might as well give him the rest of this fluid. The other great part about these little lure locks, if in fact you do get to a point where they have other medications and there is a physician there, you can easily administer medicine without having to use another IV. And his fluids are almost done, so we're going to go ahead and clamp this off here. And another thing you can do too, there's a little clamp on the extension set. We're going to go ahead and clamp that off too. So that locks it, so no blood should be dripping down back into this tubing. You know, everybody always freaks out, they see blood in their tubing. So we'll go ahead and we'll clamp that off, so as you see is the saline right there.
All right, if I ran out of fluid, like I had a bag with me and the bag has drained, would I want to leave the IV in?
Absolutely. So that's a good point, Gary. So what we can do at this point then is the bag is done. We've exhausted that. So this is where it's great that we have this little lock here. So this little lock can come off. Pull that off, and there you go. So you stay that in. The whole point is that can stay there for probably 3 days. Usually in a hospital they say after 3 days you're going to want to go ahead and take that out and replace it. But you can transport, you always have the IV, you need some other medications, you need some more fluids, so we could hook that
when
back
the
up.
Professionals get there, they don't have to worry about trying to find a vein, because we've already established one if they need it.
Absolutely.
Awesome.
So that's another good point of doing an IV is, you know, the IV access is already there. And something happens, he starts bleeding more. You know, as you lose blood volume, it becomes harder and harder to put an IV in. So we have the IV in now, let's hydrate him. If something happens, we need to do another one. We can easily start another IV.
Well, I will have to say, that is relatively pain-free. It was pain-free for the whole part of it. There was no excruciating, oh my God, he's killing me. It was really nothing. So taking an IV is super easy. I know there's people out there that struggle with it, but taking one is no problem. And as you can see, it's pretty simple really to give one. Like it's not, you know, voodoo magic science. It's relatively straightforward.
All right, so Gary asked a comment about taking an IV out. When would it need to be taken out? So the reason why you always want to have a clear screen over top of where the IV goes into the skin is so you can see what's going on there. There is something called an infiltration. So if something happens, Gary gets moved, he gets bumped, or if something happens with the vein, it can cause an infiltration. And what does that mean? So that means instead of the fluid going into the vein, into his vascular space, that fluid is going to be going into his skin. So you constantly need to be assessing anytime you're giving fluids. So what would happen then? Well, it would start going into the skin, and his skin is going to start swelling. So this whole bag of fluid, this entire bag of fluid, if you're not watching this whole thing could be in his skin right here bubbling up. Imagine how painful that's going to be and how that's going to feel. It's not going to feel good. So at that point, you're going to say, hey, let's go ahead. We need to get rid of this IV. Let's start another IV. So go ahead, start another IV, get that going, get this locked off and discontinued. And now it's going to be time to go ahead and take this IV out. What are you going to need for that? You're going to need some tape, and you're going to need some all-purpose gauze, something to hold on top to get it to clot. So this was a 16 gauge IV, so it's going to bleed a little bit longer than a normal IV would. Why? It's a bigger hole. You know, a smaller IV is not going to take as much pressure, as much time, and all this is dependent on whether, you know, the person's on any blood thinning medications, whether or not they take aspirin, they take Plavix, anything else that's going to cause them to have a prolonged bleeding time. And the safe bet there is to just hold pressure a little bit longer. You're there, you can do it. If not, you know, you can go ahead and wrap a bandage around it that's going to be a little bit tighter to hold pressure until you can get to a point where you're able to do that. But you know, it's just going to take, even at the longest time, it's going to take a couple minutes to hold pressure to get that clotted off. The big thing is you're not going to want to leave a tourniquet on somebody that their hand goes to sleep or hand gets numb. So we're going to go ahead and get our gauze ready here, and we're going to go ahead and pull this off of Garry. So we will go ahead and get all the tape off,
which is the most painful part.
all right, so now what I like to do is I bend it up and fold it, quarter it, put it over top. I'm going to hold pressure as I am pulling out the IV. So you can see here, this is what's actually in your vein, this small flexible catheter right there. All right, so that's what's in. There's no needle right there. So this we're going to dispose of, and I will show you guys what you can do after we hold pressure here. So we're just going to hold pressure on Garry here for a little bit and get this bleeding to stop. All right, so from here you're going to want to put a little bit of tape down on top of it. If you have bigger, longer, thicker tape, you can use tape to add some pressure to that. And it's not pretty, but we're on a battlefield. There we go. So another thing I wanted to show you guys too. So what do we do about this? Well, anybody that's taken like a basic EMT course or any medical course, you know how to take gloves off. So we're going to go ahead and put this in our hand. We're going to go ahead and pinch, pull our gloves off, turning them inside out. So even if they were bloody, you're not getting anything on you. Put it in your other hand. You could reach in underneath, and there you go. So regardless of what kind of midget germs Garry has on his blood, they're right there inside. You could throw that in your bag till you get to a place where you can properly dispose of it. All at the same time, no blood on my hands.
So that was pretty simple and straightforward.
That was pretty simple.
Is that how they usually go for you? Is it?
Sometimes it's a little bit cleaner than that. Most of the time I'm not used to some of that equipment that you had. The equipment that I use, it kind of seals it off, so when that needle retracts there, no blood would drip back out, so you would not have any of this blood all over.
Well,
but,
most likely in the situations these viewers are interested in, someone's probably bleeding out of a bunch of other holes on them anyway.
Very true, very true. And you know, that's the thing, you know, you carry medical equipment to be used with you. The other guy that's out there, he may not know, he might not have experience with some of that stuff. You know, it's all generally the same principle, same idea. That IV was a little bit shorter of one that I'm accustomed to using, but I mean, you know, everything's relative. I mean, you kind of need to, it's sort of like Garry and I had a general idea of what we were going to do for a video, but some of it's improvised, you know. I didn't see some of the equipment he had before, and you know, we did with what we could do.
And as a patient, I was more than happy with my care. Like, it went in, it didn't hurt. Like I said in the video, the tape coming off was the most painful part, so, you know, bravo.
All right, good deal.
So I like it.
Any other questions you have, Garry?
None that I have. If you guys have any, just put them down there, and if I can't answer them, I'll give Mike a call, and he can either get on and answer them or tell me the answer, and I'll get on and answer it for you.
Fair enough.
Awesome.
All right. Well, thank you.
Thanks, guys.
All right.
Although you do have a deft touch.
Well, thank you.